Hello and welcome to another episode of the Melbourne Athlete Development Podcast. Today I have with me Dr. Melinda Smith. Melinda, thank you for being with me today.
Thank you. It's great to be here. So thanks for the invitation.
So from our brief discussion before we started recording, it sounds like you wear many hats. So it'd be great for you to give us a background of who you are and what you do to give some context to our discussion today.
Yeah, of course. So I'm a physiotherapist. Currently, I work clinically at Clem Jones Centre Physio and Rehab. So that's a private practice that's located here in Brisbane. And I'm also a lecturer at the University of Queensland. And so in that role, that's an academic role that involves both research and teaching. My teaching is across the different programs that we have here at UQ. So that includes undergrads, the graduate entry masters, and also then physios who are coming back doing their masters in sports or musculoskeletal. And my research is, no doubt we'll talk about further, but I guess, you'd say I've got a special interest in lower limb musculoskeletal function and health, but a particular interest in the foot and ankle. And so that's really become a key focus for me in my clinical research and also my teaching sort of activities.
Is there anything in particular that's influenced your interest in the lower limb and specifically the foot and ankle, or was that something that I think by default you went into because of some of the research that you did along the way?
Yeah, I think the latter, to be honest. So it really all stemmed from my honours degree. And so I guess from that nature, I ended up in my honours studying foot and ankle taping, and really from there developed a love of it and continued with that. So I can't say that before that I necessarily went, I definitely, love the lower limb the best. I mean, some of my classmates and I, we used to joke about particularly the hand and the foot, kind of going, okay, we're going to be physios minus the hand and the foot. And so ironically, here I am, with a special interest in sort of that exact, area, being the foot. So yeah, I didn't necessarily develop that. I suppose in my undergrad, I did start to feel a bit of a pull towards musculoskeletal. And I suppose as many people do in that undergrad, I particularly within that had that focus, on sport physiotherapy as well. That was something early on. But yeah, it really came down to, I decided I would do honours. I looked at the projects on offer. I really liked the sound of the project that Bill Vicenzino had put up, which was foot and ankle taping. And then it was in the process of doing that, I loved the research process way more than I expected to. I really went into it thinking, well, when I graduate, on paper, if this is something that maybe, appears as an extra skill or gives me that, edge over, another, person going for a similar job, then, that's a good reason to do it. But, loved it so much. Continued to work as an RA 1 day a week after I graduated and was working as a physio. And then, one thing led to another. And before I knew it, I was into PhD and academic roles and yes, it goes on.
It's interesting because I've tried to dabble a bit in research, and you're clearly a better person than I am, because I found it actually quite difficult because it really does require you to be very disciplined and persevere with getting into the nuance of a particular topic, and also, the going through collecting and analyzing data. What is it that actually interests you to actually continue pursuing research?
I love that you were able to identify that from, as you say, your dabble, in that regard. Because you're right. I think that is one of the misconceptions going in, certainly as a student. You think that it will be this easy process, but it actually is challenging. And I love that you identified that kind of persistence. It does require a lot of determination and persistence, sticking at it. And patience, I would say, is the other thing. So I'd say patience is the really big challenge, because, you can spend years doing the same thing, collecting the same data in the same way on a, number of people, to hopefully eventually get to the end of, that could take you quite a few years before you actually have the data that you can then look at to try and understand that question that you set out to answer. I guess why did I love it and why do I keep doing it? I think I'm just really curious by nature. I actually love the process of learning. And so I guess doing a PhD, it's almost like I suppose I would have been the person that maybe just continued to study different degrees just because I love learning. Like I did love being at uni and studying, and I'm quite nerdy in that way. But so I guess for me, it's a way of continuing the learning and feeding that curiosity. But yeah, continuing to feel like I'm growing and developing and challenging myself. And yeah, the research process will certainly do that for you.
It's something that I've thought about a lot with research, where because it is quite an arduous process, there's often sometimes a little bit of catch up between like what's happening clinically and what's happening with research. Do you actually see that the research process is being completed more quickly now with advancements in technology? Like, do we see that the ability to complete, whether it's a primary study or maybe even like a secondary study, like a systematic review, is getting more rapid with the use of technology? Is that actually changing the process at all?
Yes and no. So I think it should be. Whether it actually is happening that way, I feel like there still is a little bit of a lag between, what's produced and then that uptake in clinic. I think that with technology, as you mentioned, but also changing the way that research findings are disseminated. So podcasts like this and, infographics and, the wide range of dissemination these days compared to, all of that information just being held, in a physical, journal. That certainly should be starting to speed things up. It's easier for us to, share all of that knowledge as it happens. And I suppose the other specific examples I can think of, you mentioned the systematic reviews, and absolutely, if you think of systematic reviews, previously and what that process involved, which was a lot of just manual handling of the papers, of crunching the numbers and collating all of that in Excel sheets. And, now there's software programs that are specifically written or specifically designed to facilitate each step of that process, which definitely does speed that up and make it easier to work with people across the world as well. And then, of course, AI. So AI would be a big one. If I think of one of my own research projects, the biggest barrier there was we collected MRI of people with and without, or the foot muscles, MRI of the foot muscles of people with and without heel pain. And I don't know how experienced, listeners are, yourself are with MRIs, but when you're measuring muscles, you go through and you segment on each slice that muscle and add that up to a volume. And that can take, so when we first did this with the aim of measuring every single individual muscle, the first time I did that, it took me 7 hours to do one foot. So you can imagine when you're then trying to do that in, a group of 30 or 40 or 50, those large numbers that you need in samples start to become unrealistic. So AI is definitely one there that I can think of where, although on one of my projects, that did lead to a really long lag time in terms of getting that measurement done. I then worked with a very smart fellow called Dr. Ken Weber at Stanford University, who managed to teach the computer, so developed a convolutional neural network, to do that in about 7 seconds.
Wow.
So now I'm like, okay, we just need to do another project measuring foot muscles so I don't have to measure them this time and we can just process perform the measurements in a few minutes.
I remember I did a podcast with Adam Bryant from, I don't know if you know him, from the University of Melbourne.
Yes, I do.
And he mentioned, and I mean, this is not something that's necessarily going to happen today or tomorrow, but in the future, as technology progresses and develops and we get wearable technology that we know is highly reliable and highly valid, whether you may be able to then opt in for your data to be used in for research, but essentially would mean that you don't necessarily ever need to go into the lab because your wearables are measuring, it could be basic things when we think about things like cardiovascular measures. It could be related to exercise output, but, there may even be more sophisticated measures over time when it may be able to quantify and measure biomechanics and other ways that you move. And it's an interesting concept because it starts to then completely change the landscape and about how research can be done because you don't necessarily need to go into the lab. but then also too, just the sheer amount of data that you could collect if you've essentially got a whole population group to be able to collect and disseminate data.
Absolutely. I think that, I mean, and there's certainly that feeling that that is the way of the future, right? By being or finding ways to be able to develop these big data sets, because one of the, limitations we often face is exactly what you said, getting people into the lab, recruiting, the numbers. So provided that, we can find those ways to do that in valid and reliable ways out in the field, it definitely has potential to facilitate those bigger numbers of people, bigger data sets that we can perhaps answer some of those bigger questions from, and especially those longitudinal questions, because they're the really, challenging ones that would be facilitated perhaps by, technology in a process like that. Yeah.
So you mentioned that a lot of the research you've done is looking at foot and ankle function, and also looking specifically at heel pain. And so would you be able to talk a little bit about some of the research that you've done, and we'll elaborate from there?
Yeah, certainly. So, I suppose to start with the reason it's and one of the classic challenges of research that we mentioned before, the challenges of research, and with this one, it was you go in with a question, but you actually have to take about 5 or 6 or 7 or 8 steps back before you can actually even go in and answer that question. So, I was really interested in. I attended the International Ankle Conference that was on in 2012, actually. And I went to a workshop that Patrick McKeon, a therapist over in the
Ireland?
US.
Oh, no, sorry, I'm thinking
US,
someone else.
yeah,
Okay.
US, yeah. So it was at the University of Kentucky. He was one of the hosts. I don't think I'm not sure if he's still at University of Kentucky or has moved around, but they ran a workshop on the foot core and exercises, for the foot. And so that kind of pricked my interest. And I was like, oh, yeah, okay, I'm interested in feet. I'll go to this. And of course, it was within that, few years that they then released that quite seminal paper about foot core. But that was really the moment that I started thinking about foot muscles. Because I was sort of reflecting at that point in time, my PhD was about foot and ankle taping. My honours had been a lot of the research I was involved in was looking at a lot of those, passive interventions, taping, orthotics, footwear. And it did just kind of get me thinking, okay, hang on. We do a lot with muscles at every other part of the body, but even reflecting on my own training as a graduate physiotherapist, we really didn't learn a lot, particularly at the foot. And so then I started, interested. Well, what do we know about these muscles? And of course, at that time, there wasn't a lot, but it was gaining momentum. All started by that kind of foot core paper. And we've seen in that kind of, 10 years, we've seen an amazing, body of work, out of various labs, but particularly one of the labs, here at UQ with Luke Kelly and John Farris, who some of those have, moved on to different unis now. But for me, it was then understanding, okay, what do we know about these muscles? How can we measure them? Because as a physio working clinically, it was like, well, if I want to know if these muscles are affected in this patient and how I can train those, I first need to have a way to measure those. So that's really was that starting point. And I was doing a lot of ultrasound work at that time, or ultrasound and MRI with some colleagues, not foot related, that got me thinking about, well, maybe we could measure these muscles of the feet using imaging. And that was really the starting point, of coming into that.
Well, to begin with, what is the foot core?
Yeah, good question. So I don't know about the term foot core anymore. I think we've maybe come
it sort of follows a bit in that trend of the the core of the abdominal region, obviously.
Yeah, that's right. So essentially, when they're referring to the foot core, or when they have in those initial papers, they were really introducing the intrinsic foot muscles. So the intrinsic foot muscles are those muscles that reside within the foot. So both of their anatomical attachments are in the foot. And that's what distinguishes them from, say, the extrinsic muscles that, of course, have their origin on the leg, for example, and then their long tendons that, of course the foot. I think that was just a term at the time that was applied that, potentially, as I say, don't know about, that term, but certainly intrinsic foot muscles is essentially what they were highlighting and trying to describe there.
When I'm going to say, so like, and probably like you mentioned, probably the better term is just to use intrinsic foot muscles. Are there certain characteristics about these muscles in terms of whether it be related to like their muscle typology, the muscle architecture, or even just like their biomechanical position that highlight that they have a role that's different to some of the long foot muscles that originate from, say, the lower leg?
Yeah, great question. So I suppose if we think about their locations, so these muscles, residing within the foot, but a lot of them do course an anatomical pathway that is in parallel with the plantar fascia, and so of course that's one thing that's been looked at a lot in terms of these muscles and their relationship with the plantar fascia and foot function.
Because a lot of them do have an origin. You have to excuse my cat there. They do have an origin from the actual plantar fascia itself. Are you referring to?
Yeah, so they lay in parallel, but also, as you've just highlighted, a lot of or several of the intrinsic foot muscles do actually have that anatomical attachment with the plantar fascia as well. And so that's been an area of research that certainly has been reported on a lot, trying to understand that relationship. And in doing that, I think they probably have been able to tease out some of that key distinguishing feature of the foot muscles compared to some of the other important structures of the foot, such as the plantar fascia, the plantar fat pads. And really what that is that these muscles can be modulated, like they can be controlled. So the central nervous system can change what they are doing to influence what the foot's doing. So to change that energetic function at that point in time, and in that way be able to respond to all those different demands that are on our feet.
Yeah, this is an area, as I mentioned to you briefly before we recorded, I'm currently doing a 3-year training program in fascial manipulation. And fascia is an area I find very interesting, probably because we don't really learn a lot or talk a lot about the fascial system. But one of the big things that I've really understood as I've learned more about the fascial system is how a lot of muscles have expansions or origins from fascial tissue. And you can obviously think of the plantar fascia as an example of that. When you think about some of these intrinsic muscles having a relationship to the plantar fascia, is there any hypothesis for why that is the case? Is it related to then being able to stiffen the plantar fascia in certain ways? Or is there some other relationship that these muscles have with the plantar fascia, hence why they have an anatomical relationship with them? Or with it, I should say.
That's interesting. So I'm not sure that maybe the why is understood. As you say, so why is it that they have this close relationship, and how did the foot evolve? Is that something that is, different, those attachments? I haven't really come across in my readings anything related specifically to that sort of why. I think there is more information or understanding about what the kind of implications are of that. So, for example, there's been several cool studies from Luke Kelly's group, but particularly, one that did show that with activation of those intrinsic foot muscles, we do see a change in strain on the plantar fascia. And so that, of course, has a lot of implications, particularly in patient populations like plantar heel pain, where we know that although many structures of the plantar heel can be involved, we know the plantar fascia is, one of the biggest ones that is often involved in that condition. And so, that was something, again, that from that perspective, was a real interest for me in understanding these muscles more in that population, and whether this, could or should be something that we're addressing in our management of that population.
Well, following on from that, what are some of the findings, either from some of the work you've done or perhaps even from some of the work that from prior researchers have done, of looking at the relationship between some of these intrinsic foot muscles and the development of plantar heel pain? And we probably need to have a discussion a bit about like what is plantar heel pain too, because I think that's a very, generic, non-specific term. But Well, yeah, I'd be interested to hear about any research findings that have looked at the relationship between heel pain and intrinsic muscles.
Yeah, absolutely. So there are a few studies. So again, it's, every area, or it is an area that has some limitations in that we don't have huge numbers of studies. And
Sure.
those studies that have been done don't necessarily have huge numbers of people in them.
Mm,
But there was a few years ago a systematic review that collated the evidence around what do we know about foot muscle size and strength in people with plantar heel pain. And certainly from the limited number of studies, so they found only a few studies in those areas looking at muscle size, looking at muscle strength, but did overall report that those studies indicated typically smaller and weaker toe flexors and
mm,
intrinsic foot muscles. So, of course, when we're
mm.
measuring strength, we can't really distinguish between the intrinsics and the
Yes.
extrinsics. And
Yes.
perhaps that's okay because,
Yes.
the extrinsic muscles are important too. So we don't want to become, so blindsided at the, intrinsics that we forget those extrinsic muscles also make really important contributions to foot and ankle function. But if we are just, honing in on those intrinsics at the moment, that would be the first thing is that, whilst we can try and do our setup to maybe bias the contributions of the intrinsics a little bit more, we can't distinguish those completely. So then when we look to those studies of morphology, so studies that have used ultrasound or MRI to measure muscle size or muscle volume, again, there's that suggestion that these muscles seem to be smaller in people with plantar heel pain. The
Mm,
really important caveat with that relates back to one of your questions. These are all cross-sectional studies.
yes.
So
It's all observational.
to explain to people that don't like that kind of, or aren't familiar with some of that study design terminology, cross-sectional means that at a point in time, they've recruited people with plantar heel pain and people without plantar heel pain, and then they've measured that muscle size or muscle strength in both those populations and compared that.
Mm,
Um, of course, they've done other things like ensure their cases are matched so that
yes,
it's
yes.
not something else that might be the difference. But taking those aspects into consideration, when they then compare that, they can say, okay, the muscles are smaller and weaker than we saw in the people without pain. The issue there is what we know is that, okay, there's a relationship, but we don't really know causality. So,
Mm,
for example, is it that people have, smaller or weaker muscles and that contributes to potentially excessive stress or overload on some of those plantar structures and is part of the development? Or is it that people who have heel pain don't do as much? We know that their activity is reduced. And so is it that they're not doing as much? Do they have pain inhibition? Other reasons that we might see atrophy of those muscles that actually comes after the heel pain's developed. And of course, it might not be as simple as either of that. It could be a combination of the two things happening at the
I
same
was about to
time.
say, it can also be bi-directional, can't it? Yes.
Absolutely.
Well, that was actually going to be a question I asked, and I mean, you've somewhat answered it because maybe it's just related to detraining from reduced activity. But are there changes in either the biomechanics of how someone moves in the presence of heel pain that predisposes someone to get, say, atrophy of the intrinsics? Or I guess it could also look the other way. Are there, even in asymptomatic populations, do we have any information about there being a correlation between certain movement patterns with having larger muscle size, muscle mass in the intrinsics versus certain patterns that lead to smaller muscles in the foot?
Yeah, so definitely nothing quite as directly linking or implicating that. We could
Mm,
certainly make some, you know, plausible hypotheses out of some of the literature that exists. For example, we do know that people that have plantar heel pain tend to, offload. So we see reduced pressures medially, typically, particularly at that, heel presumably because they're trying to offload that area that is painful. And so I guess if you were doing that over time, then feasibly, particularly the muscles through that medial, column, so our abductor hallucis, our flexor hallucis brevis, I guess, there's the potential that perhaps they are not using and loading those, the same way. But again, that, that comes with that caveat that that's all really, hearsay. There's no study that's directly linked that or measured that. And sorry, what was the second part? I think you had a second part to your question that I might not have answered.
Well, I can't actually remember myself, but I was actually going to ask, even then too, because it's so often where in the clinical world we're trying to fill in the gaps with what we know and obviously don't know from a research perspective. But I imagine both for yourself and I'm sure a lot of other clinicians, there are probably certain observations anecdotally you see between certain patterns, whether it's related to, well, one of the questions I wanted to ask was related to, say, tissue capacity with, say, strength, assessing strength of the foot intrinsics. How do we actually do that? But then also to other observations you see with particular gait patterns or activities that you see correlate to having good intrinsic strength and capacity or poor intrinsic strength and capacity. Are there any observations that you've made, even just within your clinical work outside of research?
Yeah, certainly. So this is a real key interest for me, certainly in my research work, and as you say, then crossing over from some of those observations that you make in the clinic. So that's definitely one thing I want to look at in terms of the data that we have, and is one of the sets I'm looking at the moment. So hopefully, I will have some results that I might be able to share soon. But that idea that, how do we in the clinic assess? So are there certain movements that would implicate, good or poor intrinsic foot muscle size or strength? The short answer is no, there's not from that literature perspective. There's been people who have developed some scoring systems. So, our different foot and toe movements. So can you lift your big toe only? Can you leave that down and just lift your little toes? Can you do a short foot exercise? Can you do a toe spread? So different foot and toe movements or tasks, and then scoring that or inferring what that might mean about intrinsic foot muscle control. We've got to be a little bit careful because we don't really have good evidence to suggest those are linked yet. For example, there's not a study to necessarily say that
that's purely these particular muscles.
If you're scored this way, or if you can't do this movement, there's evidence that your muscles are smaller or they're weaker. We do know that in those movements, the intrinsic foot muscles appear to be active. So it does make sense from that perspective that we might look at these movements as, as something to assess these muscles, but we don't exactly know what it means yet in terms of whether you can do that or not, if it then relates to these muscles being strong or weak. I would say that generally, if we're looking at that balance of, and again, I don't want to appear like I'm coming across saying that the extrinsic muscles are bad, because certainly they're not.
Yes.
But one thing I would say is that if we are interested in understanding the intrinsics, another thing we could consider is whether we see that they tend to be quite dominant in their long toe flexors. And so what I mean by that is you might observe that when people are particularly in single leg balance, or when people are doing, heel raises or any functional task, could be a squat, you're looking to see, well, do we see, a lot of that toe curling and clawing, which might mean that they're using those long toe flexors more than they're using some of the intrinsics, because remember the intrinsics, one of those main differences is we would expect that they would extend at those IP joints. So we would see force developed, through the foot and at the MTP joint, but with those kind of long, straight or flat kind of toes. So again, that's something that I often will be looking for or aware of. But again, also comes with that side note that the research hasn't necessarily caught up there yet to demonstrate that, yes, people who have smaller and weaker muscles show this particular characteristic. That's really just an observation and kind of a clinical reasoning that I have, rather than something that we've been able to demonstrate with the scientific evidence yet. Yep.
It's interesting. I mean, this is, I think, a debate that's been probably going on for many years now, this idea of, like the shorter muscles versus longer muscles, deep versus superficial muscles. And like you mentioned before, I think sometimes people lead to labels that are not necessarily accurate, i.e., certain muscles are good or certain muscles are bad. I don't think it's necessarily a question of morality, as it is just probably about mechanics and movement. But when I think about, say, the foot muscles too, I think about, say, doing like a seated calf raise, where when I do seated calf raises, the thing I actually feel to begin with, to begin to fail or fatigue, is my feet, not necessarily my calf. And that to me really highlights that there's a very intimate relationship between how our whole muscular or myofascial system works, as opposed to, systems that are separate based on the particular muscle characteristics or whether they're more superficial or deep. But I was actually interested just on that. Do you think it's actually important then to think about the capacity of the foot to look at that whole force velocity spectrum? Because I know you described some of the more isolated foot or toe movements to see whether they can perform certain tasks. But do you think we need to consider looking at higher force and higher velocity, like even to things like plyometrics and jumping type tasks, to get a idea of the overall capacity of the foot intrinsics, particularly in more athletic or more active or athletic population groups?
Yeah, absolutely. So, there's a couple of good, talking points, in there that you mentioned. So the first would be, yeah, absolutely. I think that measuring strength of these muscles. So of course we're looking at the toe flexors, which again we won't completely differentiate, but from a functional perspective, it's those toe flexors, that are really important, particularly, in contributing to that forward, momentum, that forward propulsion. Measuring foot strength, and we can talk about how people can do that. That's definitely something that I do with a lot of my patients, not just the athletic ones, but I do that with a lot of my patients as an indicator of foot health and foot capacity. So we can talk about that a little bit more. But then definitely, yes, we also know that these muscles, so there's been studies that have looked at strength of the toe flexors, but also muscle size, so using ultrasound to measure muscle size of the intrinsic foot muscles, and shown that does seem to be related to jumping performance, so jumping and landing. And even things like cueing people to do an isometric toe flexion on landing, again, has been shown to assist with some of that dissipation of those, impact forces on landing. So, I think that definitely is a really important, and I think that sometimes is one of those transitions that's often missed in some of those running and jumping athletes. I think it's changing since we're getting more aware that, yes, these muscles are really small, but they also are the part that need to transfer force from some of those larger muscles, to the ground and vice versa.
Yes.
So we can't forget about them.
Well, no, and actually that brings me back to the point or question around the relationship between some of these muscles to, say, the plantar fascia, because like you said, these muscles, from purely looking at their physical characteristics, you wouldn't think of them as having the capacity to produce high forces that lead to, say, better athletic performance, but they certainly have a mechanical relationship to, say, the plantar fascia that can alter its stiffness or its stiffness strain properties that then allow it to work much better as a spring when you're using, say, the larger muscle groups of the lower leg, whether that be the calf musculature or even like the long toe flexors extensors as an example.
Definitely. And that's a really key role that's been highlighted in several laboratory studies. So this notion that these muscles of the feet are really important for that spring-like function of the foot, which I guess we historically kind of put down to, the foot, it sort of naturally evolved to be this effective spring. And it is effective and it's good at what it does. And yes, it's evolved to serve a purpose, but we now understand that it's not this purely passive, kind of role that the intrinsic foot muscles and the extrinsics, facilitate, that spring. So that dampening of force or energy when it needs to be dampened and dissipated, that storage, and also then that release and production of positive power as well. The foot muscles are involved in all aspects, of that. That also, of course, has, as you say, implications for then some of those passive structures, right? So although we mentioned that in the plantar heel pain context, for example, we don't really understand the causality. But I suppose in that clinical setting, the way that I approach it is I think, well, at this point in time, if I'm measuring your strength and you are weak in those muscles, I don't know whether it came before or after your pain, but at that point in time, it's also potentially a little bit redundant what came first, because my reasoning is that, well, if you're weak in those muscles, if I can get them stronger, feasibly that could assist me with increasing that load capacity of your foot and potentially offloading some of those structures, be that the plantar fascia or the the heel fat pad, or perhaps even the calcaneus. We know that we sometimes see bony edema, through the calcaneus. So I guess that's that kind of, line of thinking as to, how, and as I said, we probably don't have the research evidence that's quite caught up or been able to, demonstrate that. And I suppose the last thing I'd put in there before I forget it, because I know that I will, is that whilst these muscles are really important in, dampening force, producing force, contributing to, foot function in that way, remembering that the other really key feature of these muscles that's super interesting is that they have a really high density of muscle spindles. So muscle spindles,
I was going to ask about this. Yes.
Yeah. So they, of course, are those sensory receptors that are going to contribute to that information, that proprioception about, where we are and, what we're doing. So responding to that, that muscle stretch. And what's fascinating is that the intrinsic muscles have a density of these muscle spindles that's as high as what we see in a lot of the hand muscles, which is fascinating. But it's also much higher than what we see in the extrinsic, suggesting that they must play some kind of role, a proprioceptive role at the foot. Yeah.
Well, the way I look at that too is, again, how do we manipulate our physical environment? It's through our hands and our feet. Ultimately how we move is to position our hands and our feet to be able to manipulate ourselves through the physical world. And so, like I even think about going back to the homunculus, and if you look at the representation of the body, like what are the big areas? The hands, the feet, the face. These are our receptors, and I won't lift my foot up right now to demonstrate, but and I think that's actually something also, and again, this is just my pure thoughts and speculation of why, again, what's our ability to be able to manipulate, say, the plantar fascia, which clearly is a very important tissue structure for energy efficiency, for stabilization of the foot, for acting like a spring. The way that we can have the most intimate connection of changing that is through the smaller intrinsic muscles that have a much more direct relationship to it. And it's interesting, like I often think about, I don't know if you know of Mark Driscoll. He's from McGill University. He's done some really interesting research in back pain. And he did a study that he published a couple of years ago, and it was a finite element model of looking at different tissue structures that stabilize the back. So he looked at the thoracolumbar fascia, he looked at muscles like the big muscles, erector spinae, latissimus, psoas, and then also intra-abdominal pressure, i.e. replication of the abdominal musculature. And it was interesting, the biggest stabilizer of the back from their finite element modeling was the thoracolumbar fascia. And then when you get the contribution of active muscles, that created a larger stabilization, i.e. less displacement of one vertebrae on top of another and less pressure through the intervertebral discs. And then, of course, the abdominal muscular tube, but that had interestingly a smaller role. And I often wonder if it's maybe a similar relationship to the foot, where we have this plantar fascia structure that's very important for multiple roles, but then you have different muscles, both the long and the short muscles, that have an influence on the plantar fascia to help stabilize the foot. And, I think about too with the plantar fascia specifically of how important it is, because the magnitude of forces that it experiences with even activities such as walking, let alone sprinting or jumping, is of several multiples our body weight quite frequently. And anyway, that was just me thinking through my head.
That last point that you mentioned, I think, is the other thing that we really forget about in rehabbing the foot and ankle. And that's that we have many times our body weight going through these tissues. And so, again, I'm not saying that some of those isolated, foot and toe movements, isolated exercises like the short foot, I'm not saying I have a problem with them. I do use those, and I use those in certain contexts. But I think that it's not the place that we stop. So not necessarily in every individual. Of course, it depends on the case, but particularly any of our individuals where we're trying to facilitate them getting back into anything, certainly beyond, walking, into that running, jumping. We need to be thinking about how we're preparing the foot. So we've talked a lot about capacity, foot load capacity. And that's one thing that certainly, I became quite passionate about in terms of how we might train the foot and exercise for the foot is, do we actually load the foot sufficiently to prepare it for that task? And, is that why sometimes we see this, mismatch? I've seen quite a few patients referred to me for various different, plantar heel pain's been one, that, plantar plate injuries has been another. That the sticking point is that return to run. So, they have really good improvements early on and things tick along and they get back to walking and they're doing their everyday activities. But that barrier is as soon as they're trying to transition back into those running-based activities. And I think a lot of the time, they just haven't prepared the foot enough for what they need it to do. And that's certainly, what I've done with them is look at some of those higher level loading and try to sort of, take that exercise aspect, to that point, which has, seemed to have been effective in a lot of those cases. But I think that's another point that's maybe gaining a little bit of momentum at the moment around foot muscles, is thinking, beyond some of those just simple exercises. Yeah.
I'm not sure, again, if there's any research on this, but I'd be interested even just to hear your clinical opinions or observations about the relationship between range of movement of the ankle and foot with regards to the behavior of the foot intrinsics. And so, when I think of this, I think of obviously something like dorsiflexion, which obviously has a very important role in a lot of lower limb injuries, or susceptibility to lower limb injuries. But then I also think about both the midfoot and forefoot in terms of mobility, or even the ability to extend the big toe. Is there any research of looking at this and its implications on, well, I guess the mechanics of the foot, but also the relationship between the behavior of the intrinsic foot muscles?
So the most research that exists around that kind of area, looking at relationship of sort of foot and ankle position, has been probably a little bit more directly looking at force production of the toe flexors. So a lot of those studies have been looking at in the way that we measure toe flexion force, and certainly from that we know that yes, our force output is affected by the position of the MTP joint and is affected by the position of the ankle. That makes sense because, we know that we have those long toe flexors that do cross both the foot, the foot joint and the ankle joint. And so as they are, I guess, come into those positions where they have that active insufficiency, so where they're becoming, shortened at the ankle, shortened at the foot. Potentially that's why we see, drop off in some of that force output in those positions. So there's been a lot of work, yes, looking at what's the optimal positions of the ankle to generate output from the toe flexors. And we know that's towards those, it depends on, it's the combination, right? Because as soon as you get a little bit of, movement at the ankle, it then depends what, position at the MTP joint is going to generate the most force.
I'm now actually even thinking just from a flexibility standpoint, because it's something that I look a lot at flexibility. Just I did a 3-year yoga apprenticeship, so it certainly made me influence looking at movement capacity, and particularly how changes in range of movement occur when you create more tension through your myofascial system. And it's something that I often think about, because if you're quite stiff through your big toe, through your midfoot, that has an impact on the mechanics of obviously how you move. And then I wonder about the ability for certain muscles to be able to work effectively. Is there any work looking at of that relationship of looking at stiffness of joint movement and its impact on mechanics or foot intrinsics?
Yeah, definitely. So I agree with you. I think that, first MTP range is important from the exact perspective that you mentioned. So we know that once we get to a certain amount of limitation and, that seems to be around that sort of, 40 degrees or so, if we have more limited range than that, there seems to be, enough evidence to suggest that we are going to start to move a little differently, in our walking. And absolutely, particularly those muscles through that medial, column, again, you would think that has implications for their loading. Now that's not something that I have seen, measured, but certainly makes sense. There are some studies though that have played around with limiting MTP range during walking. And again, that does have huge implications for foot efficiency. So this idea that if we stop the MTP joints from moving, we do see less efficient function, at the foot. And that, of course, has to be picked up from somewhere else. The work has to go somewhere else, and it shifts to the hip. So again, there's quite a few studies that have demonstrated this kind of reciprocal relationship between what's happening at the foot, what's happening at the hip, and this kind of trade-off, per se, in the work that they're doing. So yeah, I would definitely say, again, that's something that I'll often measure in patients that I see clinically across, many different sort of presentations, but that range that they have at the first MTP joint definitely, I think, is something of interest. Again, something that maybe the research needs to catch up with, though. Yes.
As is often the case, isn't it? But no, look,
That's right.
I work at our clinic. We get a lot of athletes, and particularly a lot of runners, from distance runners to sprinters, and it's amazing to see the impacts of foot movement, and like even starting with big toe extension, on implications for the mechanics through the whole kinetic chain. And like you said, there's obviously the element too of how the muscular system adapts to try and compensate for deficiencies, but then even just looking at the mechanics of joint positions and the the kinematics is unbelievable. So
yeah,
it's
absolutely.
Now I know something that you've also mentioned that you've done some recent research or reviews in is looking at shoes and orthoses, and I think this is an interesting one in itself because I very much always look at a lot of problems that we see in the general population as what changes and mismatches there are between our evolutionary environment to our modern environment. And obviously footwear is a massive one where we've seen such a large change in footwear, particularly in the last 50 to 100 years. And then, putting that in on the background of hundreds of thousands of years of essentially walking around barefoot or having just, a thin surface to try and provide some protection between the foot and the ground. What are your findings and observations of looking at the relationship between footwear and orthoses to, I guess, think about from the standpoint of just even looking at the mechanics of how the foot moves, but then also its relationship to the development of things like plantar heel pain?
Yes, I agree. This is such a fascinating area, and something that I'm asked so much about from patient populations, but also clinicians, and probably has replaced the question used to be about, say, tape and if I tape my ankle, are my muscles going to get weak, and what's the implications, etc. And I feel like the footwear and foot inserts has become kind of the new version of that question of, well, hang on, is this a good thing? Is it a bad thing? Because as you say, there's been huge changes, from an evolutionary perspective and just how society has developed around what shoes have become, from this thing that protect our feet to being also, fashionable as well.
Well,
yeah, that's a whole nother kind of step, right?
Yeah, absolutely.
But yeah, if I come back to so I suppose first up, what's really interesting, the state of play at the moment, we don't have any solid evidence sort of either way to help us really guide people around, okay, this is good, this is bad. So certainly from the standpoint of, okay, do wearing these more supportive shoes, kind of weaken and make our, foot muscles smaller or atrophy. There's really only one small study that looked at this over time with an orthotic intervention. And although they reported that there was some reduction in size, the size measurements were actually only done in 5 people in that cohort, so that particular study. So again, I don't think we can really sort of hang our hat on that yet in sort of saying, well, hang on, this is necessarily a bad thing from a foot muscle health or atrophy, point of view. The cross, cross, not argument, not the word I want, perspective on that could be that, well, hang on, if we put something under someone's foot that actually puts the foot in a position where there's a more ideal muscle length tension relationship for those muscles to be able to produce force, then perhaps that could facilitate function. So that's a little can of worms just that I'll pop open there for everyone to think about. But if we then come to the flip side of, okay, well, what about then these shoes that are less structured in our minimal shoes? There does seem to be, there's certainly more studies that have probably looked from that perspective of, okay, if we have these interventions of a more minimalist, less structured shoe, what does that seem to do to the foot? And there does seem to be some suggestion that, yes, that might assist in, we see, slightly bigger, stronger muscles with some of those studies. And that's interesting because one of the latest things I saw was a paper that actually looked at a barefoot intervention for plantar heel pain. And, that was fascinating to me because on the one hand, one of the first things that we often advise people to do, of course, is to avoid walking around barefoot. Particularly
get a heel lift in your shoe,
Yeah. And, I suppose it serves a purpose, doesn't it, for a lot of those presentations, particularly, people that have that very fat pad related, symptoms, putting some kind of cushioning under there, is definitely going to give them some immediate relief of their pain. So then it becomes about, what are those, longer term? I guess that paper certainly came from that standpoint of, well, we know that when we walk and run in less structured, so you're more either barefoot or minimal shoes, we do shift a lot of that load to the foot. And so that can become a very natural way of getting the foot muscles stronger. So, I certainly don't, disagree with that, but it's just how to then do that in a transition period. I guess that doesn't blow up the foot and the calf. But I definitely do see that the thinking along that lines that, well, hang on, couldn't this be a great mechanism for training the foot muscles as compared to doing certain exercises, for example? Yeah.
I actually recently had, I'm sure you probably know her, Catherine Mills from Macquarie University.
PhDs at the same time down at the AIS, yes.
Oh, there you go. Yeah. And so, she's obviously done a bit of research and looking at barefoot or minimalist shoe running.
Yeah.
And it's interesting, as we were talking about, where, there was obviously a big craze about 10, 15 years ago where it was all about barefoot shoes or minimalist shoes. And then, of course, you had the people going from one extreme to the other of just all of a sudden just wearing no shoes or minimalist shoes. And then, like you said, getting stress reactions, blowing up their Achilles. Exactly. But actually, it's probably something in between and it's probably even more applicable to the general population of just actually spending time in either minimalist shoes or actually walking barefoot, because it does seem to provide a very different role for getting your intrinsic muscles working. But I even think about, like you mentioned before, the fact that they are so highly innovated in mechanoreceptors like muscle spindles, of the actual feedback that provides to help, I don't know, guess perhaps stimulate afferent feedback of the intrinsics to the sensory motor system, and how that regulates movement patterns through the lower limb as well. Because I do wonder about the issue of less input from our feet. And I kind of liken it to our hands, where if you wore gloves all the time and didn't use your hands, you would lose that fine motor control that we have. And I do wonder if how much that is an element that we need to actually maintain or develop in the feet, because most of the time we're walking around in shoes or we're walking around on very even, flat surfaces.
Yeah, Yeah, and I guess it, at this point in time comes down to as well, making sure that we're thinking of both of those aspects. So I certainly think there are times where, like, if I think some of the patients that I've seen, there's definitely those presentations that there's no way I could have said to them, I want you to, walk around barefoot, or here, try this shoe that's less. I
Of course.
absolutely would not have been able to do that.
No,
But
no.
I think, I suppose personally where I think maybe it fits together is that idea that, well, sure, we might be able to use some of these devices, for some of that control of loading, potentially, overloading if we think it's a load related, issue. But as long as at the same time we are actually investing that time in training that foot muscle system. So that's certainly the approach that I have with a lot of the patients that I see, is that, yeah, absolutely, we will use different, footwear or inserts or devices to try and give some of that, short-term or acute, sort of pain or symptom control. But I think it's also really important to be, working with the muscle system and developing that capacity within the foot structures, themselves. Yeah, I was going to go on something else, but I thought I'll stop there just to see. Yeah, sorry if that answers before I ramble too much in that direction.
No, I said no. Please go on.
Yeah.
What were you going to mention next?
Well, no, I was just going to say in that regard, tying back into what you're saying, some of the recent work we've been doing, I've had the great, kind of privilege of working closely with an industry partner in Frankie 4 in the last role that I was doing the last few years at QUT. And that was fascinating, having the opportunity to help them evaluate, what their footwear and their inserts, were doing in these different patient populations, because that's what they were experiencing was, one of the big populations they had coming through their shop front doors, or online, why did you buy these shoes, was women with heel pain. And so they, funded a study for us to run at QUT so they could evaluate, okay, well, what are these shoes, doing? Because they didn't want to be another one of those footwear companies making outrageous claims that perhaps weren't, substantiated.
Sure.
But yeah, what was interesting in that, when we're talking about that kind of acute symptomatic relief, was that in those ladies, so we got ladies with heel pain and plantar heel pain, sorry, I should say, into the lab, and this was just a one session where they wore 6 different, conditions, and we were really interested in teasing out that idea because, again, we have these. This notion that footwear is potentially important in our management of people with plantar heel pain, but we really have little information from the literature as to how to go about that. In some of the recent expert, consensus, a paper by Dylan Morrissey a few years ago, there was that suggestion that, yeah, we need to get these people in a supportive, shoe that has some cushioning, that, potentially has some, heel to toe drop. Yet there's really been little evaluation of that. So that's exactly what we did, is we went, okay, well, let's take that and let's look at, so we looked at plantar pressure under the heel. We looked at impact forces at the heel, and then also comfort. So we asked these ladies, about their pain and about their comfort under the foot in these different conditions. And what was really interesting there, so we had 6 different conditions, and 5 of those conditions were a shoe that sort of fits that recommendation. So it had a compressive outsole, it had a heel to toe drop of 14 mil. And in that shoe, we then tried 5 different inserts. So these inserts varied from being flat and lightweight EVA through to being some of our PU materials with more contouring or different degrees of contouring. And we compared that to then that flat, lightweight EVA insole. So one of the conditions that was used in that test shoe was then also used in a shoe that didn't meet those guidelines. So a Dunlop volley that has that rubber outsole, doesn't have any of that heel pitch. Well, heel pitch is like 4 millimeters. And what was really interesting is we often, or I think what I see in the literature, we get very fixated on insoles, and there's been a lot of research in orthotics in managing plantar heel pain, but not so much about what footwear we put those into. And so what we found in our study was that same flat insert that was just a lightweight EVA foam. When it was used in that test shoe that had the compressible PU outsole and the heel lift, it was effective at reducing the rate of impact loading during walking. It reduced pressure under the heel, and it was also rated as more comfortable than when the same flat insole was used in the in the Dunlop Volley. So again, we take away from that, well, the inserts, might have an effect, but actually the footwear matters as well. And so feeding back into our conversation about footwear, I think we've got a lot more work to do around, well, yeah, what does footwear do? It's not just about, what's inside it, but also what's happening, in the shoe itself. And yes, we need some more answers. we need some more studies, certainly, in terms of some of these effects on foot muscle function and over the long term. Which, yes, hopefully watch this space. It's an area we're trying to get off the ground, but like everything, it's about show me the money, right?
No, for sure. But I also think I also think too of, in the very near future, do we actually have 3D printed shoes that are bespoke to individual needs? I mean, again, what is individual needs and how you bespoke that is probably another question to ask. But you do wonder if we're heading in that direction where in the very near future you actually have very, very unique tailored shoe footwear.
Yeah, what an intriguing idea, right? Yeah.
A question we always like to ask our guests, Melinda, is things that you're interested outside of your professional work. Is there anything that you're reading or any things that you pursue outside of your day-to-day work that you particularly passionate about?
Yeah, reading is definitely one of them. I love reading. I love the opportunity to, curl up and spend some time reading, which doesn't always come about with, two young ones and as you say, work and those sorts of things. But no, when I enjoy reading, I'd say, one of the books that was really good for me and made me really sit back and think was, it's called 4,000 Weeks. I don't know if you know it. Oliver Berkman. Yeah.
It's a fantastic book.
What a great book I tend to, whilst I read different things, I also read some, novels and, fiction, but I really do love those philosophical, so things like, 4,000 a Week, where it's like, what's the meaning of it all? And it kind of goes beyond, on first glance, it's like, oh yeah, this is another book that will help with that kind of productivity, time management, how to do it all, right? Which is the challenge, so many of us face, trying to balance all of these facets of our life. But he just comes in with this completely different, challenge of, well, hang on, how are you going to choose to spend the time that you have? And it's insane. So for the listeners who haven't, read this, it's like the title 4,000 Weeks comes because that's the average lifespan of humans, right? So to suddenly think, 4,000 weeks, when I think of it in that terms, it doesn't sound like that long. So,
well, and look, I was just going to say for listeners, because I would agree, it's actually had a big influence on my philosophy, because we do live in the world where, you wear the badge of honor of being busy and, I'm doing this and I'm doing that and I'm going to the next level. And particularly nowadays where there's just so many podcasts and books of this is how you're more productive, and, the most successful people do, these 10 things before 7 a.m. and you've got to do more and you've got to sleep less. And it's one of the things that I really took away from that book is, and you alluded to, is everything that you do, whatever decision you make, comes with a sacrifice. Whether that's related to you want to work more, that's fine. But there's obviously sacrifices you make in your personal life and things that you pursue outside of that. And, the list goes on. And, it's funny. I think we can be often very hard on ourselves these days of we're not doing enough. We need to achieve more. My neighbor's doing this. This person's got a bigger house. This person drives this car. This person's pursuing, this point in their career. It's, we're pretty brutal with the expectations that we have.
Absolutely. And that probably filters into one of the other, and again, probably a pretty classic one. Most people will know, the name Brené Brown, but I also love reading anything by Brené Brown. So, she's, of course, all about, putting yourself out there, being brave, being vulnerable. And again, it feeds into that point that you had around, we can get sort of stuck in sort of, trying to do more, comparing, thinking we're not good enough. And actually, you know what, you kind of, after reading a lot of hers or listening to her, in her TED Talks or podcasts, it's like, you know what, it's easy to sit in the stands and have an opinion, but, put yourself out there and get in the ring and, be a part of it. And I suppose that's the other thing, that keeps me, in the research world is it's like, well, I have these ideas that I'm developing and these observations and things that I see with patients, but, then it gets to a point where it's like, okay, let me actually dig into this and, kind of put my money where my mouth is, so to speak, and see how this hashes out. And that doesn't have to be, doing the research. It might just be that you're actually going to the research that exists and, looking at, well, what does the literature say and how does that support this observation that I have? But yeah, that's the other thing I took from reading a lot of Brené Brown's book is, just about, that power of being brave, having a go, putting yourself out there. So encourage others to do that.
Are you someone who's active on social media with like talking about your research and publications that you've done?
I've had periods where I've tried to, or where I've thought, yes, I'm going to really get into this and kind of engage, and then I sort of spend some time on it, and then I go, oh no, I'm out. So yeah, I have to say I'm still a bit of a fence sitter there and a jumper kind of over the fence and back over the fence. So I've certainly had times because I think that it's a potential for great conversations and great reach and diversity in our conversations. But then I sometimes do shy away when, some of those conversations come with, some of that anonymity or, aggressiveness or that is quite different, say, to, I trained in the days where those conversations only happened when you were at a conference face to face, right?
Yes.
So yes, I haven't got my mind made up on that one yet.
No, look, well, no, I only just ask just in terms of if people are interested to look at your work, but I know like a lot of your research is on ResearchGate, and I don't know if there's actually, I can't remember if I came across, because I know you just recently moved to UQ, but I remember finding some stuff on QUT. But I actually completely agree. I mean, I'm not someone who's big on social media myself, and I grow tired of the, very passive nature of social media. And like you said, people behaving or saying things that they would never say if they actually were speaking to you in person.
But certainly people can find me, if they type in, my name in UQ, or I also, because I have developed one of my other passions around, always loving foot and ankle, but, was always waiting for that one session at a conference that presented something, foot and ankle related. So decided that, well, okay, I'm going to develop some resources around professional development in this space. And so people can also look up Dr. Alison Grimaldi, and I write some blogs for Alison, who's another physio here in Brisbane, is well known by a lot of people for her teaching around the hip. We've developed an online course and some face-to-face workshops. So again, that's another place people can find me if they're interested in any of what I've spoken about. Yeah,
fantastic. Melinda, thank you very much for coming on today. And again, as I'll just always say to our listeners, like please do like, subscribe, leave a comment. It's a really good way to help spread our message and get more people to an opportunity to hear about someone like yourself, Melinda, talking about your research and stuff that you know about the foot and the ankle. Thank you very much for being on here today.
Thank you. It's been great fun. It's always time well spent, being able to, chat to another like-minded person, about these kind of topics. So, yeah, I've really enjoyed it. Thanks very much.